This is National Breastfeeding Month, and we're joined by OBGYN Dr. Sarah Whitehead via FaceTime right now. Dr. Whitehead, how you doing today?
I'm good, thanks. Thank you for having me.
No, it's our pleasure. It's our pleasure. So what are the advantages of breastfeeding?
So there are a multitude of benefits to breastfeeding that are fairly well known, but just shortly for mom, is a lot of great bonding time with baby. And then the calories you burn, which was always a plus for me, was that 300 to 500 extra calories a day that you can burn and get back to pre-pregnancy weight faster. And then obviously for baby, the antibodies that you get through the breast milk protect the baby from a lot of different diseases, illnesses. It's associated with lower rates of obesity and type 2 diabetes in children as well. So there's a great number of benefits. And I didn't mention as well, though, for women, there are lower rates of breast cancer and ovarian cancer if you breastfeed.
Okay, yeah, no, that's very important. How can the young moms, how can the new moms, increase the breast milk supply?
So firstly, and I think most importantly, is making sure you have a really good latch right from the get-go. In the hospital, utilizing your lactation consultants is really important and key. But a good latch will ensure that the baby is stimulating the breast very well and emptying the breast, which will then cause the body to produce more breast milk. Also, some extra things you can do are skin to skin, so that helps kind of increase breast milk supply. During the first couple days, baby will breastfeed 8 to 12 times. So, feeding on demand initially, some women do need to get into a pattern and schedule it, but at first, letting the baby set up your milk supply by letting them feed whenever they want to and latch onto the breast as much as they want can really help set up the supply early. And then later on, oh, go ahead.
No, I was going to say, can you do breastfeeding and formula at the same time?
Yes, so you can actually mix formula and breast milk together. Although you work so hard for your breast milk, you don't want to throw that away. So I might keep it separate myself, but you're welcome to mix it. Fed babies, that's the best way to go. So supplementation, if needed, is important.
Okay, we got about 30 seconds left. How long should a mom breastfeed?
So that's a very personal question. If you look at the guidelines from WHO, UNICEF, they recommend up to 2 years. If you look at our stats in our country, 80% of babies approximately are breastfed initially. Only 60% are breastfed up to 6 months. I think 6 months is a good goal. 1 year is a great goal. It's really whatever you and your baby are able to accomplish and what you personally want to do.
All right. Dr. Sarah Whitehead, OBGYN at Brookwood Medical Center. Is that correct? Brookwood Baptist Medical Center. Thank you so much for joining us. We appreciate you.
Thank you for having me. I appreciate it.
All right. We'll talk to you very soon.